So PCOS can cause a range of symptoms that might cause a woman to present to her GP, and these can include things like fertility problems, or it might include a range of other symptoms like weight gain, hirsutism or acne. In addition to that, irregular periods obviously are really common as well. So if someone has a really rapid onset of symptoms or very severe symptoms, then it's important to consider that they might have another cause for their symptoms, such as a more sinister cause like an ovarian tumour, and that's why it's important to refer these women on for specialist assessment. It's really important to do a thorough history and examination, focusing on the symptoms and signs of PCOS. So, for example, you want to look for and ask about hirsutism, looking both at the distribution and the extent of it. At this point, it's also important to ask about hair removal methods, what methods they're using and how often they're using them, because when you look at a woman, they might not look hirsute, but they might be plucking or shaving every single day. You also want to look at the extent and severity of acne and also ask about their periods and fertility issues. After performing a thorough history and examination, then you can consider further testing, such as blood tests looking at the androgen profile and looking for any underlying causes. And then you might consider whether a pelvic ultrasound is appropriate. We don't use pelvic ultrasound in women who've not been sexually active or in adolescent women because ovarian cysts are so common in this group that it's not specific for the diagnosis. It can be really difficult to explain, but I think often what women want is an explanation for their symptoms and how their hormones are different and in what way their hormones are affecting their symptoms. So I usually describe PCO as a whole body condition, not really just related to the ovaries because the name is confusing. I then talk about androgens or testosterone, the fact that it's actually a female hormone as well as a male hormone, and that excess androgens can cause hirsutism and acne. I also like to discuss insulin resistance as that can be a cause of difficulty losing weight. And I describe to them that insulin is the hormone that controls blood glucose levels, and when people are insulin resistant, it means that the insulin doesn't work quite as well, so they need higher insulin levels in order to control their blood sugar level, and the higher insulin makes them put on weight and also increases their testosterone levels. So often we spend quite a lot of time discussing this because it does help women understand the cause of their symptoms. And then we might go on to discuss longer term impacts of insulin resistance and obesity and the long term impacts on the risk of diabetes and cardiovascular disease. There are a couple of symptoms that are really common but are often not brought up, but women often will discuss it if you're prepared to bring it up. The first group are disordered eating behaviours. So this might be binge eating or purging, and it's really very common in PCOS. The studies demonstrate that, and it's important to address because it can really affect how women manage their weight in the long term. The other aspect of health that's really important in PCOS is psychological health. So it's very common for women to have depressive or anxiety symptoms, and it's also really important to address this, not only for their quality of life, but for their long-term health. The first thing from the doctor's perspective is to recognise that management of PCOS is often really complex and it can take a while. So you're probably going to have to do this over multiple consultations, and it's a fairly slow process often. The first thing I like to do is really focus on what are the patient's main concerns. So what is the primary symptom that they are worried about, and start with that. Is it their hirsutism? Is it the acne? Is it their periods? Obviously, from a medical perspective, we're particularly worried about endometrial protection and making sure they're having at least 4 bleeds a year. It's also really important to address fertility issues. So a lot of women come to the clinic very concerned because they've been told they can't have children. So it's important to discuss with them that actually around 60% of women with polycystic ovary syndrome will conceive without any problems at all, and that for the rest of the women who will need some help, it's not necessarily IVF. There may be less invasive procedures that they can have to support their fertility. It's also important that we adopt a multidisciplinary approach, so it can be really helpful to, for example, refer to a psychologist if there are psychological issues or eating disorders, or refer to a dietitian or an exercise physiologist to help with weight management. Really, this is a whole body disease and we need to think in whole body holistic terms. It's really important that women with PCOS have ongoing contact with a health practitioner, whether that's their GP or a specialist, to monitor for these long-term problems. In particular, complications such as diabetes or heart disease, but also things such as amenorrhea and unopposed estrogen, for example, increasing the risk of endometrial hyperplasia. So for someone who's relatively stable, they might only need to touch base with a GP or a specialist every 1 to 2 years. But for women who are having symptoms or who might have pre-diabetes, often more frequent monitoring is required. GeneHow's website is a really excellent resource for patients and clinicians. If you refer women to the website, they can find links to some really excellent evidence-based, easy to understand resources. And you can also order these resources for free to have in your practice. They contain some really useful information about symptoms and treatment. There's also excellent information for practitioners. So the Polycystic Ovary Syndrome evidence-based guidelines are linked to the website. There's some health professional webinars which contain some really helpful information for doctors about investigations and diagnosis. And there's also the GeneHow's Polycystic Ovary Syndrome GP tool, which is a really nice summary of the process of diagnosis and management of PCO.